Hi everyone. So I am getting ready for Dr. Spiegel to do a procedure on me called microneedling, and that is going to stimulate my collagen and help to get rid of the hyperpigmentation. And if you can see those little divots in my skin where I have old acne scarring, that should definitely help with this procedure. So stay tuned. See you soon.
Hello, so what we're going to do this afternoon is or it could be morning where you are, we're going to do a microneedling procedure. Microneedling is an exciting procedure wherein lots of little needles, we hate to use that word, but that's what they are, they're about 2 millimeters long, but they don't have to be that long. We use it anywhere from 1 to 2 millimeters, typically in the range of about 1.5 millimeters, and those little tiny needles repeatedly kind of poke your skin. Doesn't sound like a fun procedure. However, we apply a topical anesthetic, and the topical anesthetic makes it fairly comfortable. Some people, including myself, have actually fallen asleep while it's been done to them. And this little device just kind of glides across the skin. You'll see a little bit of blood in the beginning as we do it from these tiny needle pokes. But what happens is that soon goes away. Your skin looks red for overnight, sometimes a little bit longer, sometimes much less. And during that time frame, we want you to be using a nice skin rejuvenating serum or cream that's going to get in through these little perforations, help your skin to really build collagen. And these little microscopic injuries are creating new collagen, smoothing out skin. It helps a whole lot with acne scars and other kinds of skin blemishes and scars. So if we take a look here, you can see there's some old scarring here, and if we look on this cheek, even a little bit more. So we're going to go ahead and do it, and she's been numbing up for a little while. I use hyaluronic acid. Can you turn to the side here? Hyaluronic acid is the same material that is in fillers like Juvederm or Restylane or Voluma. It's the same kind of material, and this is just a different formulation of it. And this is a nice lubricant so that this device will slide nicely across the skin. Plus, the hyaluronic acid gets into your skin, which is something that we would normally have injected. So we've got a tip here. These tips come in different configurations. This one is a 36 needle tip, and if you want to look here, I've just put that on. I don't know if you can see that, but there are a lot of little needles there, and we'll get that going here, and you'll see it start to move. You can see that makes a little humming sound. And I can adjust the depth. We're going to set this at about 1.5 to start with. And off we go. Here we go. You'll feel a little tingling here. I push a little softer in the beginning so that it doesn't feel uncomfortable. And then we push a little firmer. And how does that feel?
Fine.
All right, so I've been doing this for a couple of seconds here, and you can see there's a little bit of blood on the skin. That can seem scary, but you can tell that something is actually happening here. If you look closer, you can see there's some little pinpoints of blood coming out of the skin, like here, here, here. And that's just some of these many, many, many little micro perforations that have gone on that are going to heal and build up the skin quality.
And it feels like we've got a piece of sandpaper going across my skin. Very, very tolerable though. Nothing unbearable or uncomfortable.
When you wipe that away, you can see just little fine red dots. That means we've gotten a good result thus far. This kind of flush that we see, that'll stick around, a couple of hours, and then it's going to continue to fade over the next several hours and into the evening. Okay, well, we've finished. As you can see, she's a little bit red, a little bit flushed, no blood anywhere, but that's all. And I've just rubbed some hyaluronic acid in, again, the same sort of material that's in Juvederm or Restylane or any of those fillers. That's going to soak into the skin better. It's going to give some growth and stimulation to the collagen, increase the hydration of the skin. She's going to now use a growth serum over the weekend and for the next several days to keep her skin replenished and really stimulate that collagen growth. You can also use a vitamin preparation. There are vitamin C creams which could also be helpful. And this kind of procedure typically is repeated a few times, but after each one, you really do see a noticeable improvement. And of course, all this redness that we're seeing now should be better in just a few hours, and if not, then by the morning.